All right, we are live on Facebook, so let's get started. I just wanted to thank everyone for joining us today on this beautiful sunny afternoon. It's going to be a great not long weekend, great weekend. I'm Stephanie. If you don't know me, I'm the Director of Operations at the Chamber, and we're here for you, whatever you need. We have tons of resources, support, connections to experts, giving away 15, 30-minute consultations, lawyers, accountants. Um, if there's something that you need or a question you have, please just let us know and we can connect you. And now with the slow rollout of the economy, we're going to be your go-to source for information of how to open and what supports you need, what you need to put in place. When the information becomes available, we'll make sure we have it for you. But thanks for being here today for Explore Local webinar series, an idea that Erin from Strive brought to us. It's been an awesome series just to give some positivity and upbeatness to the community. So with that, I'd like to turn it over to Erin from Strive to take it over.
Thank you, Stephanie. So for those of you who don't know me, I'm Dr. Aaron Binstock. I'm a chiropractor and co-owner of Strive Health and Performance. And we're just located in Coquitlam, Austin and Nelson, across from the newer Safeway. We have chiropractic, registered massage therapy, physiotherapy, IMS, acupuncture, kinesiologist for active rehab. And we also specialize in concussion management. And we got the news that we are allowed to open pretty soon. So we just need a little bit of information as to how we can go about that safely. And we'll get that out to everyone as soon as possible. Before we get into this lecture webinar here, again, I do want to thank the Chamber for hopping on board as soon as I called them up, and they just wanted to do what they could to help. So thank you for helping make this possible. And when I was trying to think of this idea for the webinar series, I had kind of a couple goals in mind. One was, how can our local businesses, small businesses, help each other out during this difficult pandemic? And at the same time, how can we help out our community for those of us who are, most of us, if not all of us, stuck at home with not a lot to do? And so, as Stephanie mentioned, we've had a lot of fun with some of the things we've done so far to try to create positivity and enjoyment in people's lives when there's been a lot of negative stuff going on. And I think, obviously this one's going to be a change of pace. And I know it's not geared for this fun factor. I think it's really important because, mental health has affected a lot of people. And I think during this time, you can argue that all of us have been affected in some way, shape, or form. And I know, I've had a lot of ups and downs through this. So I'm really excited, and I'm thankful that we do have Dr. Narita and Anna here to talk today. So we are going to talk about mental health. They are from Strawberries and Sunshine Healing Center, which is in Poco. They have lots of services to offer, which Dr. Narita will touch on. And, we're going to discuss basically this whole crazy change. We haven't really had time to adapt to it. So how do we do it? The anxiety, how do we deal with the stress? I'm going to ask a lot of questions here, and I encourage everyone to ask questions. Now's the time. If you are shy or you just kind of want to stay anonymous with your question, you can go in the chat box and just message me privately and I'll ask for you. Otherwise, just throw your question in the chat box, and I can put you on mic, or again, I'll just ask it for you, okay? So without further ado, I am going to hand this over to Dr. Narita, and you can just introduce yourself. Before I do say that, we are giving away a couple prizes today at the end. So Dr. Narita has offered up an awesome book and some magnesium supplements, which she'll touch on how valuable those are. And we're also going to give away a chiropractic assessment and treatment at Strive. So Dr. Narita, take it away.
Thanks, Erin. And thanks so much for asking me to be here. This is so much fun. I love collaborating and working with other people. I've been in practice now for almost 20 years and in Poco the whole time. And my practice really evolved from being like this one-woman chiropractic show to this integrated healing center. And the reason why I did that is because of my own health journey and my journey of my family. My son has a neurodevelopmental disorder, and So I needed to find some things that worked as a mom to support him. You know, he was really struggling, and he'd come home from school and he'd close himself in his cupboard and cry for half an hour after school every day. And I'd done all the normal doctor things that I knew how to do, and I always felt like I was missing something. And anyway, so we found some tools that helped him, and Strawberries and Sunshine really evolved out of the need to support these kids and moms like me that have kids like them in our houses. And that I got tired of driving him around to 8,000 different places for all the different things that he needed. So we wanted to put as much as possible under one roof so that families could get the support that they need. So we offer things like chiropractic and massage therapy, but we have a full neurosensory integration program, and then other services that complement that kind of thing, like acupuncture and counseling and reflexology. So basically everybody can come in and mom can go get a massage while Johnny's doing his exercises, or, you know, parents can go and sit with the counselor, because these kids are really hard on our relationships too, and the siblings. So that's kind of how Strawberries and Sunshine evolved. And so Anna joined us a year ago. She's one of our counselors. We offer adult counseling, and Ariana Jones is our play therapist, another adult counselor too. But Anna is great with anxiety, and she's going to talk about the techniques and stuff that she uses. And so I'm going to pass it over to you, Anna.
Thank you. So like Narita said, my name is Anna Ferrari. I specialize in trauma, anxiety, and depression. I'm very much and the link between the mind, the body, and the emotions. So, you know, as I've been in this journey, there's a lot of things. If that's okay, I'm just going to jump right into it, Aaron. So, you know, when this pandemic hit, we were aware of some of the stuff that had been happening in other countries, but not really here. And there was it created a lot of uncertainty. And when we talk about mental health, anxiety, and change, it opens up a whole, you know, can of worms for each one of us, or it can anyway. So change, when we want to make change, we go into, you know, there's 5 stages. So we go, okay, well, I'm not ready to make a change. I don't know if I want to make a change. And then we kind of, that's a pre-contemplative type of stage. And then we start going, okay, well, maybe I want to make change. And then we contemplate about it. And then we prepare to do the change, and we prepare, you know, we do action, and then we maintain it. We didn't have an opportunity to do any of that. You know, we basically, you know, right from all levels of government to doctors to friends, everybody was getting so much information, and it created a lot of uncertainty. And if you've never had anxiety before, you may have felt some of it. And each one of us experiences anxiety in very different ways. So, you know, if we can't anticipate where anything is, you know, this unseen danger is coming from, you know, it does create a lot of, you know, feelings that just they're not our normal way of doing things. Not being able to go see your doctor, that's not a normal way of doing things. You know, even, I don't know how many of you guys have experienced going into a grocery store, and you know, you're with the cart, and suddenly somebody comes out of, you know, from another aisle, and it's like, you know, and it's this big gasp, and, you know, that there's, are they too close? Are they not close? Are they, you know, so uncertainty. And anxiety, like I said, it doesn't come out of nowhere. And anxiety, when there's unpredictability and the unknown, it creates, like, as I mentioned before, an experience where it's like, okay, it could be body felt, it could be mind, it could be your emotions. So there's a couple of things that because of the body, mind, emotion connection, there's a couple of things that I talk to people about. So if you can all imagine with me, you know, we all have a window of tolerance, and within this window, there's things that have happened, and you know, you can set them aside, you know, disappointments, and you can maybe forget about them, and you're okay. We handle life in this window. But then this pandemic hit, and because of the uncertainty, you know, we go to our thresholds of that window. And when we go beyond that threshold, say we go above, it's called being in a hyper aware state or hyper aroused state. When you're hyper aroused, that's the anxiety part, because now you're hyper vigilant. Where's the danger coming from? And if you guys have heard of the fight, flight, freeze phenomena, you know, fight and flight is the anxiety part. So fight can look like, and you know, maybe if you guys all take a moment and think, okay, where have I been during this time? So fight can look like verbal fighting. For some people, it could be physical fighting, especially for the kids. It could be anger, frustration, impatience, or flight. Flight can look like, I want to sleep because I'm avoiding. I'm going to leave this room if you're in a conversation with somebody, because I can't deal with this right now, so I'm going to avoid it. It can look like being on our phones a lot. It can look like being on TV. Those are the healthier coping mechanisms. Another one is addiction, right? Substance abuse, because that helps you escape. So when you consider that, you know, being in that hyper aroused state continuously, it also can lead to, wow, I don't want to feel anything. I want to just, this is too much. So we suppress those feelings, and we flipped down to depression. So depression is the frozen state. If you have ever felt stuck, okay, I want to do this. Oh, I can't. It's not a lack of motivation necessarily. It's that your body is frozen, and you know, I want to do this. No, I can't. So there's you know, when we consider that, so we're either on a hyper aroused state or a hypo aroused state. It's hard to just say, okay, well, get over it and go back to normal. It doesn't work that way. Uncertainty leaves us in that's what it is. It's uncertainty. And so there's not a lot that you can just go, okay, forget about it. So there's a lot of techniques that are out there, but I'm going to teach you guys some that will bring you back to the moment. So if you have heard of mindfulness type meditations, mindfulness relaxation techniques, or anything like that, really what it's saying is bring yourself back to the present, to this moment. So what are some of the things that you can control? We can't control what's going on out there. We can't control what the government's doing. We can't control what other people are doing. We can't even control sometimes what our family's doing. But what are some of the things that are under your control? So you might say, oh, well, I don't know. There's nothing. I don't have anything under my control. Well, consider, can you control what time you would wake up? Can you control the time you even set the alarm? Do you shower? Do you not shower? Do you brush your teeth? Do you not brush your teeth? So those are things, when I talk about what are the things that you can control right now, that's it. You know, the little things that are under your control. So that's mindfulness. You can be mindfully washing dishes. I know I don't like washing dishes either, but you can. So, you know, you take the plate and literally going, okay, I have this big plate in my hand, and I'm now taking the scrub and the soap is coming and I see it and it's forming and I'm cleaning the dish, and now I put the water and I'm seeing the water running. So that's,
sorry to interrupt. So is the intent here to basically, focus on the fact that you have a plate, focus on that you see water, and that takes your mind off of the stressful thoughts that you had?
that's right. It actually, what it does, Erin, it actually brings you to the present. So anxiety is very future oriented, the uncertainty of what's going to happen. Mindfulness brings you to the here and now. So when you're washing the dish, you're focused here. You're no longer focused in other areas of your life. Now that's to help bring you back to the present. When you're in the stress response, so the fight, flight, freeze, it's either, okay, what's happening? What where's the danger? Where's it coming from? But mindfulness, when you are here, it allows you to not have to think about all the trillions of different things that can happen.
And so it sounds like there's within that window, there is a normal or typical amount of stress or anxiety that's kind of okay, right?
Yeah.
But is there a way for us to know, or at least have some sort of a sign that we have gone into that hyper aroused state, and therefore it's time to try some of these coping mechanisms?
Sure. If you've gotten mad at your family or partner, if you have felt irritation, you're outside of that tolerance window. If you have, some people have described it as getting fast heart palpitations or sweaty palms. What are the other things? Fast chest breathing. So it's almost like you're not quite hyperventilating, but it's not a deep, normal breath.
Okay. And what about for people with children, for instance? I'm imagining this is adding to people's stress. I'll be perfectly honest. I have 11-month-old, and there are times when he's whining, and I think the stress of everything that's happened is adding to it. And yeah, I could get a little irritable, but I don't have that moment to just disconnect with him. Are there, in a scenario like that where people are having trouble with their, I guess, children at home, or added more stress, is there any other techniques that could help with that scenario?
Yeah, so a big one is the breath. So I mentioned that when you are in that hyper-aroused state, you can have a bit of a shallow chest breathing. So if you can be aware of that so let me backtrack a little bit. So mindfulness is about bringing you back to the present. And if you can practice that, you're slowing down your process. You're slowing down your thought process. And so the more you can do that, the more present you can be, the more you'll notice if the breath is shallow. And so when you breathe, there's two types of breathing. There's the parasympathetic breathing, which is from the nose. So usually when you're stressed, your nervous system activates. And when it activates, it sends a signal to the brain, to release the cortisol, or the stress hormone, and it gets you into that prepared state of fight, flight, or even freeze. And then normally our parasympathetic nervous system is supposed to come in and help us bring that down. But when we're on high, or that high arousal state, it's hard for the nervous system activates and the parasympathetic nervous system comes in. It's hard to do that. But nose breathing activates the parasympathetic. So if you take a deep breath, and if you guys all do it, and then you can exhale either through the nose or through the mouth. That's okay, either one. You can even see the shoulders kind of settling in. So when your son is fussing or whining, if you can take a moment and go, and then exhale, you're more likely to put yourself back into the tolerance window.
Interesting. And this mindfulness strategy, is that something you recommend only in these scenarios where you're in that hyper aroused state, or is that something maybe every morning you take 10 minutes to practice?
Yeah, I actually recommend that you do, when you wake up, you do if you can do 5 minutes of some sort of breathing exercise. So you do, deep breathing for 30 seconds, normal breathing for another 30 seconds, and just kind of alternate in between. If you do that for 5 minutes in the morning, you're likely to have be much more settled throughout the day. If you do it before going to sleep, you're more likely to have a deeper and better sleep. But mindfulness, to your point, is mindfulness actually a practice of. It's not big. When you're in that hyper aroused state, it is really hard to remember to breathe, or to take a step back and have that patience.
Okay. And this is kind of a sidebar on this now, because you're still seeing a lot of clients, right? Rightfully so. And do you find that people are, this is a new thing for a lot of people, or are they just recognizing it now? And maybe a second part to that is, do you find people maybe questioning, like, something is different about them now and weird, like almost like they're thinking that catastrophizing, like something could be wrong with their brain, perhaps? I don't know. I'm just curious.
So a lot of the people that I'm seeing have anxiety. And for some of them, because we've been working on a lot of techniques, life has gone on as normal, whatever their normal is. For some people where they haven't seen or hadn't experienced anxiety, there is a questioning. And usually when if I can explain to them what's going on, because it is normal. To have anxiety is normal. If we didn't have anxiety, or we didn't have the stress response, we'd be all out walking in the middle of low heat highway without a thought to safety. We just wouldn't have any anxiety over crossing the street. And so anxiety is actually normal. Where it becomes problematic is when it actually prevents you from living the life that you want. Being able to go out. I know it's a little bit different right now, but usually, the isolation is very real for people with anxiety. And what's happening right now, because a lot of people have had to stay in and now are having to, there's no more distractions. The job isn't a distraction. Now we're having to deal with family dynamics, whereas before, you'd be away from each other for at least 8 hours, or if not more, a day. And so, there is a lot of questioning, what is happening to me? Why is all of this coming up right now?
And so you mentioned family dynamics being changed, right? So are there, do you have a lot of people maybe that it is having a strain on their relationships? Do you see that type of stuff? And if you do, I know you can't generalize this to everybody, but is there, some general tips that you have for them?
Yeah, what I would say is set very clear boundaries. So within a family, if you're not used to spending a lot of time together, if there's no, and when I say boundaries, it's like, okay, I'm feeling a little bit off right now. Let me go to this corner of the house or this corner of the apartment and just give me some space, or, asking that. So there's a lot of people that are working still and in the home. So there's some boundary issues there as well, right? What used to be your safe haven is now your workplace and your home place. And so setting boundaries, some very clear boundaries. If you're on the computer, this is a work computer. If you're, this is the room that you're designing or assigning for work, whether it's the living room or, wherever you've chosen, but be very clear with your boundaries.
So I do have a question. I'm not, Roger, if, oh, perfect. Okay. So I'm just going to unmute Roger for 1 second because he has a question he'd like to ask.
Okay.
Let me just scroll down or Roger. All right. Or unmute. Okay, Roger, if you don't mind asking Anna your question, please.
Sure. I did a mindfulness course about 6 months ago, which was prior to this COVID stuff. And that was very helpful, thinking in the now. But now we're in a situation where the stress has gone up like 200%. I'm sort of staying at home, can't see grandkids and kids. And I'm having trouble getting through each day. Some days are good, like this has been a good day. I've been on 2 webinars and I've already been I snuck a ride in my car, went outside, and I'm planning on gardening this afternoon. So I'm probably gonna go to bed tonight saying, I've had a good day. I've gotten through the day. I've been, like Bonnie says, I've been kind and calm and reasonably happy. Other days, not so much, because I can't really fill my day. I heard what you said, which was watching a lot of TV. I'm watching probably too much Netflix, but that's the withdrawal thing that's happening. What are some of the more specific things? Is it good to get up and put a little bit of pressure on yourself and say, I really should be doing this thing, and feel good if you get 60% done? What are some of the pragmatic things that helps us get through the day?
So setting a routine, Roger, thank you for that, because it actually is crucial to actually set a routine of your day. So if you know what you're doing and this is where I was talking about what's under your control, the predictability. So if you know your routine that you're going to have, so for today, for example, you knew that there was going to be a couple of Zoom meetings and you have the gardening and you're going to do the car. So you've set a routine for yourself for today. The days that you haven't done that or you don't have those fillers, I wonder what kind of routine you have. You know, are you waking up in the morning at the same time? Are you, do you have, set things to do? And it is challenging, you're right, because we're home so much. But even, okay, I'm going to get up and I will do this mindfulness meditation, or I'll do this in the morning. And then I can, in the afternoon, I can do this. So you're actually creating your own schedule. Not like a work schedule, because it has to be a little bit different right now, but you have control of that.
That's awesome. Thank you. And thanks for that question, Roger. Oh, did you want to add something?
Yeah, and I'll just add, if you're having that, there's, it's too much, you can't seem to bring yourself to that, to the here and now. There is a technique called using your 5 senses. And if you haven't heard about it, it's you use one sense 5 times. So sorry, I'll back up. The senses, right? Sense, your sight, smell, taste, hearing, and touch. So you'll use one sense 5 times. You'll use the next one 4 times, the next one 3 times, the next one 2 times, and the last one 1 time. So for example, if I'm out and about, or if I'm at home, I'll go, okay, what are 5 things that I can see? And so I'm very specific. Okay, I can see a red mug and it's got a straw. And so be very, what you're doing is you're slowing things down. It's bringing you back to the present. So you'll do that 5 times. Then what are 5 or 4 things I can touch? And I'll do the same thing. This is soft, this is harder, this is sturdy, or what are 3 things I can hear? What are 2 things I can smell? What is 1 thing I can taste? So that, to add to Roger's question, is that's also another mindfulness technique that brings us to the here and now.
Thank you. I want to kind of touch on a stuff that I'm noticing, you know, whether it's going to a grocery store, or even if we're going for a walk, you know, I'm finding like some people are scared to look at each other or even say hi. And it's, I mean, it's okay in terms of, you know, people can do what they feel is most safe for them. But I guess maybe if, like you as a person, if you're okay with doing those things, like, is it impactful on the people around you to at least smile and say hi? Like, I don't want to come across as in I'm telling people that they shouldn't, you know, put their head down. But again, maybe sometimes that could just be of fear, like what is creating that fear? Do you know what I'm trying to get at? I think I'm rambling a bit, but.
So yes, because I've experienced it. I've experienced the first couple of weeks, or the first time I went shopping, I had never heard a grocery store be so quiet, and people, and there's actual, you know, you're walking on, like I said, if someone comes out of what feels like out of nowhere, there's a gasp that happens. And so, but that's because they're actually in their hyper aroused state, right? So so our brain has two parts to it, right? There's the frontal cortex, and this is where our logic and reasoning is. And then we have our primitive side of the brain, which is the amygdala. So more the reptilian, and this is where we hold primordial emotions like fear, panic, disgust. And so if you consider, you know, someone walking and then if they're fully in that stress response, and in their primitive brain, right, that gasp, they don't even want to get close to you because the fear is so great. And this is part of we don't know, and we didn't know as much as we know today. And you know, that uncertainty over this virus, how quickly can it be transmitted? And so is it even just looking at you, am I going to get it? That is for some people are. And so, yeah, they're not going to look up. They're not going to want to talk to you. And so it also depends on where you are in that spectrum. What's your tolerance level?
So speaking of spectrum, then I kind of want to bring up a conversation you and I had the other day. And I mean, depending on where this goes, some people might view it as a little bit controversial, but I want to bring it up because you said something that really resonated with me. And this kind of goes on the fear of being shamed if, you know, as we're obviously opening some restrictions to a degree, you know, some people are hanging out in parks and some people aren't. Some people haven't left their house. And I think, again, what everyone wants to do on their own time is okay. Obviously be respectful. And we're not condoning going beyond what we're told to do. But, you know, my scenario was, you know, we were just at a park and I saw 4 older men sharing a joint. And, you know, I got a little annoyed. I didn't say anything to them, but in my head, I'm like, why are you guys doing that? You know, we're all trying to conquer this thing. And it did create a little bit of stress. And you said to me, you know, I guess you can elaborate it on, but hey, the thing that you think of is you never really know what people are going through, right? And, you know, for instance, one of those guys could have been suicidal and his friends had to pick him up. And yes, that is unfortunate that, you know, they're basically sharing saliva, which goes against what we're trying to do here. But in that moment, that is something that needed to happen. So me personally, you know, don't worry about something like that, right? Can you kind of elaborate on just that whole scenario and topic?
Sure. So when you said it, as I was listening, I thought exactly that, what I said to you. We don't know what the other person is going through, you know, and so if we can have some compassion to what others are doing or not doing, and in our way, because so I have my risk tolerance is here, and somebody else's could be here, and somebody else's could be much wider, and somebody else's. So it depends on on what's going on personally. And there are a lot of people that, yeah, they're breaking the social distancing because there is a high risk of suicide, or this person just doesn't know if they can go another day, or we see a lot of people lining up for Home Depot, for example. And I don't know if maybe the gardening project is the one thing that's going to keep this person from falling back into addictions, or it's whatever it is that they're using as a coping mechanism. And we all have different coping skills and techniques that we learn from a young age throughout our lives. And some of them, I don't see them as good or bad. They are what they are because they helped us survive. And if you remember, all our bodies and mind want to do is keep you alive. You hold your breath, eventually it's going to be forced. Your body is going to force you to breathe. And so the reason I said, if we can look at people, those that are staying home, social distancing that way, those that are going out, if we could look at them with compassion and go, okay, I don't know what your circumstances are. And I'm going to, make the choice to believe that this was so important to you that you had to do this. You had to go out, you had to share that joint, or you had to go get that gardening tool. Does that?
Yeah, for sure. Yeah, I think it's a good point. It's I think it's just been a tough spot for a lot of people because we're making sacrifices. Why can't you? But I like you have to that is out of your control, and that goes to some of what you're saying. You can't control them, but at the same time, there's a whole other element to this whole pandemic, and it's not just the virus; it's the mental side of things. And so you just never know, which I think is a great viewpoint throughout life in general, not just right now. So it was just nice to hear that from you, to give a different perspective, basically, right? And so on this note of we're starting to potentially get to ease certain restrictions for those who are excited to kind of resume stuff but are still a little fearful. Do you have any tips as to how they can, conquer that next step? Like they want to, they're just nervous.
Well, yeah, there's going to be a lot of fears still, and because it goes back to that unpredictability, uncertainty on really, if we ease the restrictions, are we going to see a spike in cases? Maybe it's not you, but maybe it's the person that you live with that might be the most vulnerable. And so that might make you a little bit more like, oh, I don't know if I want to go. And so sometimes sitting with that uncertainty can be quite uncomfortable. But if you can listen to your body, and your body does tell you what's going on. It could be a tight shoulder, it could be a hip, or it could be, your TMJ acting up, or, you've got some twitching, or notice your breath. And this would probably be the first thing that I would say, okay, the thought of going out and either going back to your office or being in a social environment, how is your breath? What's your breathing doing? If it's fast and shallow, you're probably not ready. And, you might need to do a little bit more internal work before you can go out. If we force that, then we go into that hyper aroused state and create more anxiety. And so now it's like, what are you anxious about? And so now I want to avoid that anxiety. So I'm going to avoid doing this, and then now I'm going to get more anxious, but I'm anxious about being anxious about what I'm avoiding. Does that?
Yeah. And I'm curious if the mind is going to work similar to the body. Like if someone has an injury, and let's just say their low back hurts, or has been hurting if they went for a half-hour walk, and I think they're ready to start walking, I tell them, oh, let's just go for a 5-minute walk first. So they have a positive exposure, but it's obviously just baby steps. And then, hopefully the next time they can walk 10 minutes. So is there some sort of like similarity in that sense that they can just do little bits at a time? So it's a positive exposure, which gives them confidence to do a little bit more.
Yeah, so just that, like that positive exposure, if I can, and know how much I can tolerate in being outside and being with others, maybe it's, okay, this is the distance in the beginning. And then maybe I can come a little bit closer because I feel a little bit safer. Or maybe it's wearing the mask because that makes me feel safe. So a lot of the times the conflict comes between that, the social responsibility and your own needs, and balancing it all. So maybe wearing a mask is not so much to, to not infect other people, but maybe it's because it makes me feel a little bit safer. And then I can now go those 5 minutes, I can be exposed to a little bit more.
Awesome. So I am going to wrap it up soon, but I do have another question. So I'm just kind of forewarning anyone, if they have any questions, try to get them in. So this isn't just COVID now. In general, how does someone know when it's kind of time to reach out to you or any, other health professional that, is, I guess, clinical counselor? Like, when is it the right time to reach out?
So really, like I said, anxiety lives in all of us. We call it a little bit, I'm a little bit nervous, or this is an excited nervous, or, but when it's in the way of you living your life. If you can recognize it from before, like I said, anxiety doesn't come out of nowhere. There's things that have have happened to us or have been set in place. And our bodies and minds are so incredibly intelligent. However you responded to stress as a child is exactly how you respond to stress even now, because your body and mind went, oh, if I fight, that was good. I'm safe. I survived that. And so then we develop this, that's the way our stress response goes. And so at any time that I would say, when anxiety feels uncomfortable, that it's no longer serving the purpose of keeping, alerting you that there's a danger, and then you can come back to the level of tolerance.
Okay. Now, if you had to choose one book to recommend to everyone, well, I mean, not that everyone has to get it, but I'm just saying, if you were to choose one book, in terms of, I don't know, how to deal with stress, anxiety, or just in general that you would recommend, or you do recommend, what would it be?
There's a book by Dr. Gabor Mate, and it is When the Body Says No, The Hidden Cost of Stress.
When the Body Says No. Okay. I do have one question here again. So is it reasonable for clients to ask their dentist, massage therapist, etc., about their proposed safety rules?
I would say yes, because it's, if you are, you're going to be coming into their space, and there's little that you can control in terms of how they're going to run their business. But you can control whether you're going to visit them or not, based on how they've set up their safety protocols, or the
Absolutely. And I do believe I read you actually we have to post it for the public to see anyways, but I agree that you should be able to ask them. Absolutely. Okay, that's awesome. So I'm just gonna share my screen because I just want to put up some information. If you guys want to get a hold of Dr. Narita or Anna, here is their information right in here. So take a screenshot, take a picture, whichever you prefer. Reach out to them if you have any questions whatsoever. They are here to help you. And then I'm just going to share one more picture before we do the draw. Hold on one second. I'm sorry. I'm not the most technologically advanced here. All right. So in general, this is for us. If anybody has any questions on injuries, you just want advice, you want to know about getting an assessment or anything like that, please call our clinic, 778-355-3050. Thanks again to the Chamber for helping put this together and being partners. You can follow both of us on Instagram. We're always posting updates on new webinars coming up. You can also go to our website that's there. Again, you can take a screenshot. We have webinars, the posted videos as well. You can also go to the Chamber website and go to the events page to sign up and register. Again, it's all free. If you have any suggestions for future topics or webinars that you might want to see, feel free to reach out to me and let me know. Next Tuesday, we have a sommelier, Kai, and he is going to do a free wine tasting class. You don't often get that. So I have posted which wines he's going to talk about, so you can follow along. Then we've got Lift Fitness. They're going to teach us parents how to keep our kids occupied with fun and creative activities. Then we've got a running one, running injury prevention, what shoes you should be buying. We've got interior designer coming on, how to help spruce up your home with what you have. So we got a lot of good stuff coming up. So let's do a draw for the, thank you for the screenshot. Oh, perfect. Thank you, Terry. So we're gonna do the draw for, first of all, Narita, can you please just explain what the lucky winner is going to get? Can you, I think you're muted. Hold on, I'll unmute you. Can you not unmute? Oh, here we go. All right, go ahead. You're good. No, you're muted again. All right, Stephanie, do you want to do, I think too many people are doing it. I see you're still.
I think there we go. Okay. So we've got a bag of magnesium flakes. Nothing brings you more present than soaking in a bathtub. Magnesium is my favorite mineral because it has so many important things that it does in the body. So it's a bag of like really high quality magnesium flakes that can go in the bathtub. And then the other piece is a book that I got to collaborate on last year called Success Secrets for Dynamic Women, and something fun to read while you have time, while we still have time left.
I know we get a break from all the screen time.
Yeah.
All right. The winner of that, you have to be present. Sierra, is she here? Stephanie? Yeah, perfect. Okay. Do you know who she is, Dr. Narita, or no?
No, I don't. Sorry.
Okay. I will connect you two so you can do that. And the winner of the chiropractic assessment and treatment to strive is Renata Steele. Is she here? Yeah?
Yay.
Perfect. I will reach out to her then. So our time is done. Thank you again, Dr. Narita and Anna, for coming on. That was awesome information. Hopefully everyone got a lot out of that. I know I did. Keep following us, keep watching, keep supporting local. Really appreciate it. Happy Mother's Day to all those out there. My mother's watching. I love you. All right, and enjoy the sunshine. See you guys next week for some wine tasting.
All right, bye-bye.